Good evening, and thank you for joining us. My name is Casey Minnis. I'm the Director of Communications for the Multiple Sclerosis Foundation, and I am pleased to present this panel discussion tonight. We have several couples with us this evening who have that unwanted visitor of multiple sclerosis in their relationship. And they're going to talk to us at this National Family Caregivers Month special event about how they manage tackling MS together. So I'll ask them now to each introduce themselves. We'll start with Dan and Jennifer Digmann. If you could each tell us a little bit about yourself and how MS affects your lives.
Hey, sure. I'm Jennifer Digmann. I was diagnosed with MS almost 24 years ago, and I am now living with secondary progressive MS. And I was lucky enough to meet this cute man next to me. We've been married for 16 years.
And I'm Dan Digmann, and she's my better half. And I actually have been living with MS for about 22 years now. And as luck would have it, I met her at an event, and MS has just pretty much been a part of our relationship from the start. So that's where we come at this from.
Thank you, Dan and Jen. And now I'd like to go to Cherie and Dave Binns.
My first hospitalization with what we now know was MS was 46 years ago last month. So we've been in this for the long haul. We'd only been married for 4 months when I went in the hospital for that. So again, it's been pretty much a part of our relationship for the better part of 4.5 decades. I wasn't diagnosed until 19 years after that event. And by that time, things hadn't progressed too rapidly, but they began progressing really pretty rapidly around 2000, 2001, to where I became scooter dependent, was catheterizing, that sort of thing. And you want to add anything to that?
I just did a general, I followed sort of the directive of tell us about yourself. So you may want to sit down for a little while. No, it'll be short. I've been married to Cherie, as she said, since June of '75, June 1st. We met as clinical workers in an inner city clinic in Houston. And so our relationship from the beginning has always been somewhat medical, or at least related to it. So as things occurred, I was probably very open to hearing about the last appointment and the next appointment and what's going on with research. And so we've had a common interest from the get-go on things medical, and when they occur so intimately as this has, it was very easy to sort of have as much interest, or almost as much interest as Cherie. You know, you're not perfect, but so I grew up here in Rhode Island. We came back to Rhode Island after having spent 6 years in that kind of a clinic situation. And so that's it.
All right, thank you. And last but not least, Gary and Cathy Chester.
Hi, everyone. I'm Cathy Chester, and my first symptoms from MS began in 1981. But being young and happy and busy working in New York City, I completely ignored that I couldn't feel my legs, or I was totally tired. It wasn't until 1986 that I got diagnosed, and I was dating this young man for a year before that. So he and my dad took turns taking me to my back then, I think it was CAT scans and spinal taps to be diagnosed, and it was right away. And so I guess like Cherie, but and Dave that there were no medications and there was no internet. So it was a very scary, lonely time. So Gary and I have gone on this journey learning together. And he was nice enough to marry me in 1988. Go ahead, Gary. So what do you want to add to that?
Hi, Gary Chester. First of all, Casey, thanks for having all of us on tonight and putting this together. We appreciate it. I know the audience will appreciate it and hopefully get a lot out of this. Yeah, many of us, fortunately, we knew more or less what we were getting into. I think it's more of a challenge when a couple is married and then somebody is diagnosed with MS or another significant, life-altering condition. I think that you can't anticipate what's going to happen. We loved each other. We knew we were for each other, and we were going to go ahead with it. But I think one thing that helped us a lot in the decision-making and really through the marriage is optimism about the future. When Cathy was diagnosed, not only did we lack MRIs and other diagnostic techniques that are so common today, there were no medications. They put you on steroids and shook your hand and said, good luck. But we researched into what was happening. We were optimistic that there would be some disease modifying therapies, and lo and behold, they've been very helpful. But I'm not advocating that for everybody. It's just our experience.
All right, thank you. So family caregiving is one of those things that really requires a lot of on-the-job training. As you mentioned, you learn together. For those of you with MS, was there a time when your care partner didn't understand what it was that you were coping with? And for those of you who are caregiving, how was it getting that on-the-job training? Did you feel overwhelmed, or how did you manage that? Cathy and Gary, let's start with you.
Well, you
Well,
should really start.
Without going into great detail, I felt that I would be, for lack of a better term, qualified to be a caregiver, or what we're now calling support partner.
So I prefer a support partner.
Because, again, without going into my whole background, but I think I have pretty good domestic skills. I like to cook. I like to shop. I love to do laundry. Just kidding. But overall, I felt pretty comfortable in that role. Of course, sometimes you feel overwhelmed and burdened and resentful towards multiple sclerosis. But that's baked into the cake, and you deal with that in your own way.
And also, I was diagnosed with relapsing remitting from the start. And being in my late 20s, I had, and not having a child yet, I had a lot more energy and I could do a lot more then. And as aging, thank God, every year, things do change. And so we had to learn that, as well as the disease, as well as everything else, the explosion of information that's available. So it's ever changing, and it always evolves together.
Cherie and Dave, anything you'd like to add?
Again, our journey was very long, and there were a lot of years of the unknown during that time, during which we had several moves and we had 2 children, and I was working a number of different part-time jobs. I look back at that period of time in a haze. I just remember intense depression. I remember very few days without tears. A lot of that had to do with the fatigue. A lot of it had to do with just the frustration of being told that it was all in my head. that it was, I didn't feel like I was being taken seriously. A lot of that time we didn't have insurance. And so I had doctors who said, well, we could do tests, but they're expensive and they're inconclusive and you don't have the resources right now. And I felt lost in that. And I know it had to be a very hard, very dark time for our daughters and for David. So, but I have to say, on a high note, once I finally got on to a disease modifying therapy, 27 years into the process, that was a little higher efficacy than one that I'd been on for a year and a half. The depression just melted away. It was like that inflammation that was causing that kind of dissipated, and I began to function as I would have wanted to function for decades before. So.
Dave, when Cherie was going through that, were you able to understand and relate to what she's going through, or was it frustrating for you?
I think I tried my best, but I probably fell short of relating to it because it's not my personality. We're pretty much opposite personalities.
He's a snap out of it kind of guy.
Yeah, I told her to snap out of it. No, I didn't. I wasn't quite that bad about it, but I think I had limitations on when it came to empathy.
And that, having that unknown period of 19, 20 years didn't help. Because nobody could give us an answer. And I think if he'd had that answer, like people are getting today, that it would have been a whole different walk. But it also helps us to maybe give hope to others too, who are going through a similar journey, because we've been there.
Yeah, we didn't really think of ourselves as having a waiting period until the medical world straightened this all out. But we've realized it. I mean, where she is today and where she was then it's two different places, and it's done in large part to the therapies, medical therapies.
Thank you. And Dan and Jennifer, your situation is a little bit unique because both having MS, obviously you have a little bit more of an idea of what each other are going through, but I'm sure that there must be differences. How do you cope with that?
It was interesting. We had come home from our honeymoon. And I mean, Jennifer, I've never known Jennifer to walk. She's always had to use a wheelchair. I have relapsing remitting MS. She's, secondary progressive. So it's just like we kind of understand a little bit, but there's just differences. And like, we got home from our honeymoon, and mind you, this is our very first time in our house. I'm to help her transfer in the bathroom from her chair to the toilet. We had done it many times before, but this one time, it's just like I dropped her. I mean, it's just like the transfer didn't go well. She's on the floor and I'm standing over her, and I'm, this is my wife, and I dropped her on the first transfer in her house, and I'm, F-bombed this, and it was just like, I was mad at myself. I mean, and she internalized
and this whole time I'm thinking Dan wants a divorce. We haven't been married that long. So, I'm in tears thinking, oh, baby, we can probably still get the marriage annulled. And
it's only been a couple days.
Yeah, it's only been a few days. And he looked at me and he said, no, we're in this for the long haul. And so I think just the fact that, we knew each other and we both know MS. And when he says, oh, my chest is really numb tonight, I can't completely understand. I mean, I know numbness, what I experienced, but I don't know what it's like for him. But, I think there was a little trepidation from both of our parents. Is this going to be too much? but we're proving them wrong, that no, we've got this.
Yeah, I think just a lot of it comes with, for me, for us, it's really the empathy and just listening to each other and understanding and not reading into things, just being honest. And I think that helps us deal with this because yes, we both have MS, but MS affects everyone differently. So.
And just to, I know you all mentioned it during your introductions, but just to underscore for our listeners, I'm going to ask each of you, Digmann's, how long have you been a couple?
We've been married 16 years, but we've been together 19.
And Binns, how long have you been together?
We've been together for 48 years and married for 46 and a half.
Well,
I mean, we worked together. We worked together
yeah.
for that long, and probably 5 or 6 months before we got married, we realized that we were to be together. So I guess you could say that 47 years we've really been a couple. We were co-workers for the year before that.
And Chester's, how long have you been together?
This month is our 33rd anniversary, and we worked together 3 years before that.
I think it's an important point to make because so many young couples at the beginning may be wondering, how are we going to make it through this? Is this going to put too much of a strain on our marriage? And it just goes to show the length of time that you all have been together, that couples can make it work. So let's talk about how you make that work. How do you deal with the frustration of either needing that extra care and support, or the frustration of needing to give that care and support? Cherie and Dave, let's start with you.
I feel like there are very few times when I really need that support and care that's disease specific. There certainly were times, you know, back in the early 2000s where that was needed. Now it's like I can get so wrapped up and so involved in a task. If I'm on a project or if we're in a gathering pre-COVID, I can get so wrapped up that I can lose track of the fact that I am not well hydrated or that I'm getting overheated and maybe getting a little muddled in my thinking, cognitively slipping. And I just feel like just because of asking for help and saying, you know, if this ever happens again, I want you to do this. And I think those are conversations we need to have. But David will now cue me to drink some cold water or to go put on a cooling vest or to get into the air conditioning or something of that nature. I have not, except for some times that were post-op for things not related to MS, I really haven't needed him as a caregiver, except for that first episode, which had me KO'd for a good, 12 to 16 weeks, something like that. I was in the hospital and then in bed for weeks. And you know, it was a carry to the bathroom. He didn't drop me though, Dan. So
First,
Dave, thinking back to that time, was it frustrating for you, and how did you cope with that?
Oh, it was scary. It was very much of for us, it was a spiritual journey as well. It was something of coming to a point in our first year of marriage of saying goodbye to Cherie. And I can't say that we accepted it, but we came to a point of saying, well, if this is what God wants for us. And that in itself was kind of remarkable. So I felt, looking back on it, that I was able to say goodbye so early. And then without any real treatment, she just came out of it, which was, you know, it was great. it was a sense of a real healing going on. So then there were bumps along the way from that. There were, it sort of reared its head a little bit here and there, but it wasn't anything that we couldn't cope with together.
There was an epidemic of Western equine encephalitis in Houston at the time where we were living, and that's what they initially thought that I had. And I was essentially cognitively challenged, in agony, wasn't able to communicate well, eat, anything like that. And I was heavily medicated for over a month. So, it knowing what we know today, I think we would have looked a little further than just lab work and a spinal tap and, things like that.
Okay, Dan and Jennifer, same kind of question to you. Do you ever deal with the frustration of needing care or needing to give care? And if so, how do you cope with that frustration?
That's all you, dude.
My multiple sclerosis, I'll be honest, is affected. I need a significant amount of care. Obviously, Dan's helping me with activities of daily living, helping me in the restroom and shower. And, I have a caregiver during the day while Dan continues to work full time. So it can be difficult. And when I'm frustrated with my caregiver who's not Dan, I sometimes will take that frustration out on Dan. Or when I'm frustrated with the disease, I don't take that out on Dan, but sometimes he gets a little more. It's just frustrating to not be able to do things for yourself. I can't style my hair. I'm a chick from the 80s. I love fake hair. And I can't do that. And Dan does a fantastic job, and I'm blessed that he helps style my hair. But that independence, that's hard for me. And I know Dan, he's been a champion for me, but
Well, I think, at least for me, I always tell when Jennifer feels like, oh, you're doing too much, I'm just like, chivalry isn't dead. It's just like, I would do these things to help her, whether she had MS or not. And I always joke that it's like, I'm still trying to win you over, after 19 years. It's like, because, think about it, when you're dating, you would do anything for your significant other. So why does that stop with a marriage? Why does it stop when you really have to hold true to the in sickness and in health? I mean, we at least went into this marriage thinking in sickness and in sickness. So, I mean, I think it's just keeping that mentality going. So it's just that understanding. It's like, if I'm tired, I'll let her know that I'm tired. And it's just like, I'll help you in a second. I just need to rest. So, I mean, those are things. But again, I think that's where the communication becomes so key and stuff. So that's how we deal with it.
And the patience. And, you can lose your patience with multiple sclerosis. And unfortunately, at times it manifests into just ugly behavior, but we try and stay patient and supportive, but patience is big.
All right, thank you. And Cathy and Gary, anything that you'd like to add on that topic?
Well, I think my experience with the MS is a little different. I mean, we are all unique in how we experience it. But as I said before, I had a lot more energy, and I could walk fast, and I could do a lot of activities when I was diagnosed. I think I was 28. And so, after 34 years, a few things have changed. And I think my MS progresses incrementally, still within the relapsing remitting. And so, as it does change, Gary is so used to, always being there for me because we are definitely a team. Thankfully he knows, he just knows, that I'm having a hard day. And I always feel that we both feel that it's so important for open and honest communication between us, and never to keep anything in, and always be authentic with each other. I think that's helped our marriage grow, but it's also been a great relief for me to know that as I get older, that he's still there as my rock and as my support partner in every way. And I would like to add one thing, and I hope that this is okay, that our son, who's 28, he's never known me without MS. So he's grown to become a kind of man, yeah, that has full compassion and understanding and tolerance for the disabled. And I think that's very important for us to send our children out into the world for the next generation to be able to understand about inclusion and tolerance. And so I just between the two of these guys, I'm well taken care of, and thank God every day that that's true.
To Dan's point, I agree that, chivalry is not dead. You just do it because of how you feel about your spouse. But also, in our generation and other generations, we've evolved now so that I'm sure, I don't want to speak for Dave and Dan, but I might be. I've never looked at it as, well, this is something my wife should be doing. It's, you have the patient and the support partner, and Cathy does what she can do to contribute, and I do what I do to contribute. And, traditional roles are out the window.
Amen to that. So, I love that you all work on keeping that open communication. And I think that's really key to avoid negative feelings. But I think that there are a lot of people out there who are dealing with a fear of what I like to call the B word, burden. There are a lot of people out there who are afraid of becoming a burden to their loved one, or afraid that their care partner is feeling burdened by them. How do you respond to people who are feeling that way? Gary and Cathy, can we start with you?
Sure. I feel like as you were asking that question, it occurred to me that I'm painting a real Pollyannish picture here, that everything is great and we're skipping through the meadow, and that's not true.
It's not?
Not true.
That's why I don't always do these, because this stuff comes up.
Anyway.
Communication, Gary.
I'm sorry?
Communication. That's
I think, that there is a real fear that we can become a burden to our spouse, and in different ways. And it is a reality. And sure, I fear sometimes when I'm having an exacerbation and I can't do something, that I'm going to become a burden to my husband. And I feel that communication is vital to any relationship. I don't care who you are or what even with or without MS, everybody, that's the key to good, having a good relationship. And I also suggest, and I say strongly, that there's no shame in seeking outside help from a qualified therapist, because that is, I'll be honest, that has helped me in the past when I've felt this way and I needed to talk to somebody. I can't always be going to Gary for every single thing. He is entitled to live his own life too. And that's an important thing to think about. So whether you go to a support group or clergyman or a therapist, whoever you go to, a loved one, it's just important to talk about those issues and get them out there. And there might be boundaries that you might have to set. But the B word is I like the way that Casey put that. It's real, and it is something that needs to be addressed and not just glossed over. It's healthy for all of us to come to a point where we need to work together to see how we can make our lives better by addressing that issue.
And
Anything else?
I would add
I need a
that
sip of water.
I would just address those who have MS and need support and get care. That easier said than done, but maintain a high level of dignity. You're entitled to dignity, and you contribute to a relationship. And there are many MS patients who contribute to the MS community and in other ways. For example, I know Jen and Dan have testified before lawmakers. That's a critical role in the MS community and beyond. And you really have to never doubt your self-worth. You are contributing. Just because you can't walk or walk well or run, you're still contributing. 99.5% of us are not professional athletes. We're not contributing through physical entertainment or means in society. There's so many other ways to contribute. And always remember that you're contributing at the very least to your relationship.
Excellent point. Thank you. And Dan and Jen, would you like to talk about that subject as well?
About the B word?
About the B word.
And we had seen, and I appreciate that point, Cathy. It's like, yeah, this isn't to be Pollyanna and sugarcoat anything about the realities of what we're dealing with. But I had heard somebody one point that it's just like, instead of looking and feeling like a burden, feel and look at yourself as a blessing. It's just like, that's where, and so it's like, believe in that. And I think that's where you have these things. And when I had interns, and everything, it was just like, if I had a team of interns, you play to their strengths. And I know this person, I can do this. And so, like, in a relationship, and to your point, Gary, it's just like, what can we do? Play to the strengths. It's like, if anybody out there in the world wants anything done in this household, go to this one, because I don't keep good records. I don't keep track of things. So it's just like, that's her strength. And it's just like, of course I shop, I'll cook. That's what I do. But Jennifer, like, during the day with her other caregiver, they can go, they do the shopping. God forbid if I don't tell her I'm low on deodorant before she goes to the store, and she can't add it to her list, right? But those are the strengths. And so it's just, as far as being I never feel like she's a burden. It's just like, I think of it more as like my partner in crime. And so that's really what I'm about. How about you?
I think it's you all living with MS, 8 days out of 10, I don't feel like a burden, but those 2 days when you're having a poopy day, you're like, oh, I'm such a burden. And thank heavens I have a spouse that says, no, you're more of a blessing than a burden. And sometimes Dan has to be like, check your head, Jen, you're a blessing. Just don't think that way. So multiple sclerosis it's a tricky little disease, and it will get inside your head. When you can't go to the bathroom by yourself and you have to ask for some simple little thing like that, you need help. You're like, how can I not be a burden to him? But just think about the fact on September 10th, he knew what he was getting into, and he says this is what he wants. And hopefully for people out there who feel in those dark days like you're a burden, think of all the gifts that you bring to the party and what you're doing for your spouse.
We have a question that's come up in the chat on this topic, and the person asked, regarding burden, do you worry about what if your spouse can no longer physically help in the ways you need help? Anyone have any thoughts on that?
When I saw that come into the chat, I thought that was a perfect question for Jennifer.
I would be a liar if I said I don't worry about that. But I think with a spouse, I mean, I think we all think about mortality and what is going to happen. And you can drive yourself off a cliff of craziness if you're thinking about what ifs, what ifs, what if. You know, we try and be prepared. I try. Dan tries to stay healthy and think about what is going to happen. And, you know, it was funny. We had dinner with our church pastor last night. And I said something. I was thinking about the what ifs. And Pastor Dana, she said, you just need to rely on your church family. Something happens to Dan. And that maybe is one of those what ifs, like you have to start thinking about if something happens to Dan or if something happens to me, where are we going to look outside of our family and our friends? What will be resources?
I think long-term planning is key in all of this too. Several years ago, Dave and I sat down with our daughters and an elder care attorney and made known to the whole party at the table what we would like to see, and just had that discussion with everybody and pulled people into that plan, identified resources, and it's a discussion that people don't have often enough or soon enough. So I would encourage anybody that's watching this to really just take some time to do the what ifs, and don't let it pull you down. Let it be a possibility pondering rather than something that can sweep you under the carpet.
Dave, anything you'd like to add on this topic of burden?
I honestly can tell you that I don't ever feel, when the word burden comes to mind, it has to do with me. It doesn't have to do with Cherie. I've never thought of her in that term, and that seems, again, Pollyannish, whatever. But I just honestly can't recall saying, "Oh, this woman is such a burden," you know. Fact is, she's the oldest of 7 in a farm family. She's been, she's always had a lot of responsibility, and oh, by the way, she made over 7,000 masks, you know. Yeah, so where do I come in, you know? Where do I come in saying that she's a burden? She's anything but. She's a huge contributor to my life and to those around. But that's a different kind of a thing than the norm. I realize that, but she's not the norm.
So, you know, each of you may have a role where you're providing support or getting support, but I'm sure you also want to keep that separate from your role as a spouse, as a partner in a relationship. How do you keep your care partner role separate from who you are as the person that your spouse loves? How do you make that distinction? Dan and Jen, let's start with you this time.
Yeah, and it's one of those things where, and maybe it's just me. It's like I don't necessarily see an either or. I think it's all just part of the package, and so I don't. Again, I do this because I love her, not because she needs it. I mean, obviously I do it because she needs it, but it's just like, I don't feel like she's needy. I feel like I'm just doing what I do. I mean, these are things. And so but it is, those are key points. And I think, it's just the two of us in this house. And we always have to remind ourselves, I don't want a roommate, I want a spouse. And so it's just like, so we have that. And I think these are points, is pulling off what you had talked about, Cherie. It's just like, those of us living with MS, we don't hold the market on a lot of this stuff. So in the life decisions, discussions and stuff, that goes across the board, whether you have MS or not. And so these discussions and everything, whether you're caregivers or not, I mean, people have these discussions all the time. And so I'm her buddy. That's
Well, and to be honest, there is some ugliness that goes with being someone's care provider, caregiver, care partner. I mean, Dan has to do some things that I'm sure he doesn't want to have to do for his wife, but he loves me, and vice versa. I love him. And I have to say, never underestimate lipstick and trying. If I feel like, oh, Dan's becoming just another caregiver, I will put on some lipstick and I will try and say, woo this man that I love. He is not just my caregiver. I have had male caregivers. I've been very fortunate because of the Medicaid waiver program over the years. And I definitely know that Dan is not just my caregiver. Never wanted to kiss any male caregiver. I've never wanted to spend the rest of my life with any male caregiver. That this is Dan, this is my spouse, this is my forever person. And so when you have those moments where you're like, oh, it's just a roommate, I'm like, no, he's way more than that. So I hope that answers.
Yeah, a little lipstick is keeping that spark alive.
Yeah.
Cherie and Dave, anything?
I think sometimes, I've heard some talks on this, particularly where it comes to intimacy, where one member in the partnership has MS, and I've heard people say in those talks that if, for example, your partner needs help toileting and you have to clean them up, you need to put that in a compartment separate from where you enter the bedroom. And I think each of us can find creative ways to leave the nitty-gritty actual work and create an atmosphere of tenderness, of sensuality. There are all kinds of wonderful things, light dimmers, candles, aromatherapy, touch, and those things are all that you can do that whether or not you have MS or not. And I think we need to reach within ourselves and find things that draw upon the memories that felt special and try to recreate them. I think that's incumbent on all of us who are depending upon another person for any consistent aspect of our lives, that we help them to see that they're important. For me, this pandemic has really freed me up to unleash my inner creations in the kitchen, and that's one of the ways that I say to him, I love you, every single day, is creating all these phenomenal foods that he's really begun to enjoy. So whatever it is, I've got a friend who loves to paint or or she also does photographs, and she will occasionally just frame one of those things and wrap it and give it to him as a gift at the end of a particularly long day or week. So there are a lot of different things. Tailor it to your own situation, but don't ever let that person know that or feel like they're being taken for granted. Casey, you're on mute.
Dave, anything you'd like to add?
No, I'm a little more reserved. I'm English and she's red hair, although she doesn't have red hair. Red hair Irish. So no, I'm not ready to share all that, but except to say that certainly I appreciate all of her multitude of efforts in every area, that, including food, including part of getting out of bed in the morning seems to be for her making the bed and shooing me away. You know, I'm a spoiled brat. So yeah, no, there's never at any point again that I feel like I'm treating her or feeling like she's a burden. I'll probably be more of a burden as we go on in years than she's ever approached.
So Cathy and Gary, how do you keep your care partner relationship and your marriage partner relationship separate?
I think the main thing we do is continue to share interests together, especially during the pandemic. Go out and walk as much as we can and enjoy nature, which is a common passion. Watch old movies, which was always Cathy's passion, and she really got me interested in that. So
Black and white only.
black and white, yeah, black and white. Yeah. Somehow it always ends up being a lot of Cary Grant films. So I'm not sure why, but
He's so hideous to look at, that's why.
You know, you keep reminding each other of the many reasons why you got married in the first place and continue to be together. So that's how I think you separate the roles. Although, as Dan referenced, and I think Cherie may have referenced, you know, they blur together sometimes, but this is one way to.
I think they're interwoven after a while. And even from the beginning, I think they're all interwoven. You made a commitment to your spouse and you want to honor that. And if you do, and you want to make that commitment, it's just really important that we're there for each other all the time. We do remind each other of, okay, so I asked Gary out, which women are like, huh? But I did. And I also took him to a Met game when Dwight Gooden was pitching, and I could only afford the nosebleed section. And I never took him to another baseball game after that. But it worked. It worked. So people, I mean, I think something we haven't touched on too, if I may, is it's really important to keep humor in your marriage, because there are times where I might be relapsing, remitting, but I've fallen or tripped or couldn't do things. And sometimes it's not laughable, but sometimes it's pretty funny. So if you can keep humor within it, or you know, cognition, when that's an issue, you know, we'll get a good laugh out of it when I've told him the same thing 5 times, you know. So I think humor and music are really important components of keeping a marriage very happy. It's you have to get beyond yourself a little sometimes, you know.
Absolutely. Well, and another question that comes up a lot is, what happens? Everyone gets sick now and then. You mentioned that you've fallen. I'm sure there have been times when Gary's gotten sick. What happens when you need care or you need assistance and your care partner is sick? Or are any of you care partners managing your own chronic conditions, and how do you handle that as a couple? Cathy and Gary, any thoughts on that?
Well, Gary has constant back issues. He's had it for years. And there was one summer where he couldn't get out of bed. He was literally on his stomach, and I would have to you know, luckily we were living in our ranch, so we had no stairs. So back and forth from the kitchen, and you know, you get tired, you get very fatigued, but I needed to take care of my husband. The roles were reversed. And it made me really think about the question that we asked, what we were talking about before, what if, the what ifs. And so I did my best to take care of him. You'd have to ask him how well I did. But you have to also, you know, when my son was small, it's the same issue. You have to learn how to budget your spoons, so to speak. You have to learn how to budget your energy, when you can take naps, maybe when they're napping, or cook a whole lot of food. I'm gonna have to tap into Cherie's love of cooking, because I am not there yet. And do a whole bunch of cooking, which I did that summer when he was on his stomach because he couldn't move. Those are chronic issues for him and have to be addressed all the time. And so when the shoe is on the other foot, it frightens me a little bit, because I don't know how long I will last. And since we don't have long-term care, you know, having MS, I'll never qualify, and Gary just didn't get it. So we worry about the financial aspects of that. You know, we have a living will and all of that. We had the discussions that we needed, but it's a scary prospect. Again, the key is the communication, is me telling him, is it okay if I give you a meal? I need to rest. And him saying, yeah, that's fine, or no, I need something, and then you can rest. You need to work together. We're always a team. And that's really important, I think, in any marriage. And I probably said that before, but I'll say it again. It's really important to be a total team and to learn how to work things out together. Because if you can't do that, there's a real issue that pops up, and you don't want that to fester. You want to address it head on.
And I'm going back a little here, but one point I do want to make, when you have the level of love and devotion that everyone's expressed tonight, no matter which role you're in, it's okay to get frustrated now and then. I mean, I don't yell, I don't scream, I don't throw things, but I'll make faces, and Cathy knows immediately what that face meant.
I want to get him in a poker game.
You know, it's okay. You get past it. You emote your frustrations or your anger, and you move on. That's how it has to be. But you know, when I was down and out, and Cathy, when I was on my stomach, and Cathy took over, I mean, I felt her love and her care. That's the only positive part of it. But I learned a lot. I learned it's okay to just have like a tuna sandwich for dinner. You don't have to have an elaborate spread.
If you knew Gary, you'd know that that's a huge statement, because food is everything.
Cherie and Dave, anything that you'd like to add on this topic?
In a general topic of how to be a good care partner, I think taking a genuine interest in the disease process, and staying as actively involved in knowledge-wise with one's spouse, that you're on the same page, and that you have that as a sincere interest and not just a passing interest. I think that's what brings you from day to day. I think sometimes it's just, and there's so much hope out there right now that it's not a bad topic. The one setback, and there was a bit of a setback, is that she's still not vaccinated. And she's vaccinated, I'm sorry, and she has the booster, but there's just no effect. And that's a bit of a setback, but then we're looking at a lot of different answers that are coming up out of the science world through MedPage Today and things like that. But they are dealing with it. They are addressing it. We will see a light at the end of the tunnel with that.
Well, let's digress there for just a minute and let's ask everybody, how has COVID affected the way that you function within your care relationship? Cherie?
I think I have been knowing that I'm on a medication, class of medication called B-cell depleters, Rituxan for me. And I think Jennifer's also on Rituxan. And I think Cathy and Dan are both on Ocrevus. So they're all B-cell depletion medications. Last week was the annual meeting for the Consortium of Multiple Sclerosis Centers. And I can't tell you how often the presenters came to the point of B-cell depletion medications, and what they're seeing across the board is that people who've been on them for longer than 2 years are not developing any antibodies even after 3 doses of vaccine. We are apparently having some T-cell response, which could mediate that, which could help us to really fight off a more severe infection. But what they're saying is that their patients who have gotten COVID and that are on these medications are far more likely to need hospitalization. They gave the example of one 26-year-old girl who had neuromyelitis optica, which is one of the presentations with some more severe forms of MS. And she was only 26 and she'd been on Rituxan for 10 years. And she had had COVID twice. She had had three doses of Moderna on board and she died. And so what they're saying is that apparently from the NARCOMS survey, that was the latest one that they had the data on, people that are taking these surveys are taking in which medications they're on. And in this last year, the medication usage has changed so that approximately 1/3 of all people that are on disease-modifying therapy right now are on a B-cell depleter. So that means about 1/3 of us who are taking medication to manage our MS are not getting adequate protection from the vaccine, which means that we have to treat it as if there's no vaccine out there. We have to be masked whenever we're around somebody that's outside of our household. And that means that David is also masked so that he doesn't bring home an asymptomatic case of COVID and infect me with it. So I think we can't just take for granted vaccine status as giving us protection. It may protect us to a degree, but we still, until this thing is really ramped down, I think need to be distancing, masking, keeping our gatherings very small, particularly when we're eating with members of other households that are vaccinated. We still know that they're out in the main population. And I don't know about where you all live, but here, most people are not masking when they're in public. So you don't know who is and isn't masked or isn't vaccinated. You have to assume that anybody that's not wearing a mask is not vaccinated, and protect yourself if you're on any of these drugs. If you're partnered with anybody who is on any of these medications, you have to do the same.
I'm really glad you raised that point, because that was one of the questions we were asking ourselves during COVID and also when Cathy gets the next infusion of Ocrevus. Which cells are fighting the COVID-19? Are they the T cells or the B cells? I'm gathering from what you said, Cherie, that they're not really sure. Knock on wood, I guess in Cathy's case, the T cells must have kicked in.
Yeah, There's no commercial test for the T cells available, so we can't really check our responses. They were finding this in large study cohorts of people that they were looking at that were on a B cell depletion medication. I should mention that Kesimpta is also one of those B cell medications. Ocrevus and Rituxan are infusions. Kesimpta is given at home. You give it to yourself as an injection. So those of us who are on those three drugs, again, 1/3 of people that are on disease-modifying therapies now are more at risk. The other thing is if you're on an S1P like Gilenya or Mayzent, medications in that category, you also may have some reduced immunity. People are getting a lower dose of antibodies to the vaccine, or lower load of antibodies to the vaccine than those that are on other disease-modifying therapies. So it's those two classes of medications that are likely to make you respond less well to the vaccines. If you're on no disease-modifying therapy, if you're on an interferon or Copaxone, Tecfidera, Aubagio, those don't really put you in an immunocompromised position. You should still mount a normal response to the vaccines. So please be assured that you're okay if you've gotten those things. But I still would feel better about people practicing masking until we know we have this thing under control.
Well,
I just want to remind our listeners very quickly that Cherie is a registered nurse and an MS certified nurse, and she's sharing her perspectives from the information that's come out of the recent MS conferences. So just so they've got the clinical background that's coming with what you're saying, Cherie. And I also want to let everyone know that our next teleconference actually is going to be on the COVID topic. Next Tuesday, 11/9 at 3:30, our senior medical advisor, Ben Thrower, will be giving a COVID-19 update, so we can get more into that information then. Cathy, I think I cut you off. Was there something that you wanted to add on this topic?
No, it's fine. I just wanted to reiterate something that we had talked about before we started this session, was that Gary and I both did get the vaccines, and I got the booster. And despite that, and despite, following all the protocols that we were supposed to, we still both got COVID. And I really firmly believe that our cases would have been far worse if we had not been vaccinated. Gary retook his test last week and it was negative, and mine came in this morning and it was negative. We still have lingering symptoms, but this is a big but. We're here, we're talking, we're breathing fine, we're walking, talking, eating, and all that. And I just want to say that I'm very anxious about re-entering life again. I know that I got the negative. That does not mean that I'm going to go out and go to these big gatherings or to go inside a restaurant, or I even worry about going to see my mom who's at a facility being indoors, even though I know everyone was vaccinated in there. I have a hard time with that. And I know that I speak for others who feel the same, because it's a crazy virus. It's insipid, and it's just really horrible. The other thing I wanted to say, and maybe Cherie knows this because of her background, is that I think it was last summer, or maybe later than that, that the great Dr. Gavin Giovannoni had said that there were no accurate tests at that time to let people with MS who are on these medications such as us to know whether we have the antibodies that we need. So do you think that the cohort that you're talking about is a follow-up to that? Because that was many months ago. So
what they told us at the consortium was that there are about 48 different tests out there to test for antibodies, and they're being mixed up. One test for antibodies to see if you're actually infected with COVID. And it's a very different test than what you need to follow up on a vaccine. Quest Diagnostics has probably the most consistent, best reasonable test for that. And it's a segmented spike protein test. So you want to ask if you're having that done to have that segmented spike protein antibody test from Quest. That's more likely to give you an accurate answer than so many of the other tests that are out there. That's not to say that if you ask for it, it's going to actually be done, because I'm a recipient of that was what was ordered, but that was not what was reported out. So just keep your eye on things. Don't assume, look, follow up on these things. My neurologist routinely tests all of his patients on B-cell depletion medications 1 month after a vaccine. So after completing the course of vaccine, and then 1 month after the third dose. So I know other neurologists that I've talked to have said no, because I'm just never sure that I'm going to get an accurate response from the lab.
I think I'll hold off on it because I think that everything is still evolving so much. And I have a telehealth appointment with my neurologist tomorrow because she wants to see how I'm doing, which is, I think it's a great idea for anyone who's had COVID and has MS to always keep in touch with your neurologist.
On an optimistic note, there are some companies that are working on an oral COVID vaccine. So that's going to take time. Hopefully they are effective and would persuade the reluctant to take an oral vaccine.
Dan and Jen, anything that you'd like to add on this topic or on the topic of coping when one of you is sick?
Well, I think for us, it kind of like one and the same. I mean, when I have a fever, the flu, and it's like every MS symptom I have is exaggerated. So if I get a fever, I'm knocked out and can't help her. And so she's pretty much on her own. And so that's where we have to get, like, her family fortunately lives like an hour and a half away, so they can come up here. But then I got my COVID booster shot. I mean, the first two vaccines, I was okay, but that third one, it knocked me out. And so then I'm there and I can't help her. I had actually wrote about it for an article for MS Focus about a month ago, but just how, I mean, it's just like, and those are the things, those are the challenges when I'm, as a caregiver for a wife with secondary progressive MS that needs me to help her. I mean, those are the things that stress me out when I'm not able to do it. And so, when they start talking about, potential of a fourth booster, it's like, I would be I'm skeptical. I mean, not by the science of it, but it's like, it scares me, the thought of having to go back through that again. And so, so I think as far as the COVID and everything, that's what concerns me.
And it's just been the reality that I have a caregiver, and I'm fortunate that she and I can go do things so Dan can stay home and work. So we've worked it out that way, that one of us is more out in the public, and like everyone else, we figure out what's safe and we're as cautious. But obviously, Gary and Cathy have proven you can be careful and you can follow all the guidance, but it's just a really, really difficult thing. So I think the care, the partners, and that we just have to keep communication, and we need, like you said, Cherie, we need a plan. We need to think about the future. What if Dan does need to take a 4th booster shot? Okay, he's going to do it on a night where we have a caregiver the next day, or he's going to do it later in the evening so he can go to bed and he won't have to transfer me as much. So it's just thinking ahead and just trying to have your ducks in a row before you do it. The thinking that's involved, everything with this disease just takes a little extra legwork, which is ironic because that's where the damn disease works so hard to knock you down, but just a little extra legwork.
Going back to what Dan said about the article that you wrote, I did read that article and I actually shared it on the Multiple Sclerosis Foundation Facebook page that day. I hear a lot from people about, will the booster make my MS worse? It's not making your MS worse. It's protecting you from letting your MS make you worse. If you have a fever, your symptoms are going to get worse, but that's not the definition of a relapse. A relapse is a worsening of symptoms in the absence of a fever or infection. So it's not making your MS worse. It's just making you potentially feel worse for a day or two.
Right, exactly. Yeah, because it didn't cause the MS to, well, it's kind of like, when you exercise or something and
get overheated.
Yeah, it's just like the MS isn't where and so I misspoke, but it inflames my MS symptoms, and so it's like you're knocked out.
No, I didn't see you misspeaking, but I just thought, based on what I'm hearing on the foundation Facebook page, that question is asked an awful lot, and I didn't want people to misinterpret.
Yeah.
The vaccine's not making your MS worse. It's protecting you from having it get worse. Because if you're going to get sick with COVID, you're far more likely to have inflammation in your central nervous system that could potentially make the MS worse. Whereas the vaccine is just causing you to mount that immune response, which may be causing the fever and the worsening of symptoms temporarily till the fever goes down.
That's exactly how I thought of it when I got the booster. For me, or just me, I felt the booster symptoms were far worse than the first 2 vaccines. I felt like I had the flu times a million, and it was tough, but I just kept thinking to myself, it's my immune system working. For whether it was or it wasn't, that's how I got through it. And I really held on to that thought, and it helped me through. And the next day I was fine. And I felt really kind of proud of myself that I did that. And also I was glad that I had those 3 vaccines behind me. And as I said, I know that helped me get over this COVID.
Well, this has been a wonderful discussion. I want to give our listeners a few minutes in case they have any questions. So let me give them instructions for doing that. If you have a question or comment that you'd like to give, you can type it in the chat. You can type it in the Q&A, which allows you to send it anonymously. And also you can use the raise hand button on the bottom of your screen if you would like to have me unmute you and make your comment or give your question live. Let's see, we have a question in the Q&A from Ray. He says, for all of you, what is the best advice for a man dating a woman? He mentions it's Alicia in Fort Wayne, Indiana, that has MS and is new to this world. I love her to pieces and I'm reading about it to understand it, but what else can you suggest? Thank you all. Any thoughts?
She's not the disease. She's the woman that you love.
It's, I don't know, from a guy's perspective, I know you're supposed to say what a father would say to him would be, count the cost, realize that you're going to have to change. I know who you are. But know that from, I think, three guys here, our experiences would say that it's been a wonderful life. It hasn't always been convenient. There are challenges, but there's, at the end of the day, I think we can each attest to the fact that we married wonderful women with a condition which endears her to us more than anything else. And so let's don't think it through. Know who you are. Know that you may or may not have to change, but we all change. We all become better people, unless we don't.
And kudos to you, Ray, that you're here, that you're asking the question. There are nearly 1 million people in this country living with multiple sclerosis. So find support, which you're here. This is an excellent opportunity for support. And just know that you're not in this alone, and that the support is out there. And it was Alicia, right? That you can do an online support group, you can do an in-person. There's a wealth of information, and there are so many people to talk to ask questions to support you. So you're not in this alone, neither of you.
Yeah. Life is all about risk, and life is all about choices, and everybody comes with some kind of adversity, whether now or later. And so I think that you have to have that kind of mindset and separate it out, that you really love this person and you care about them. And this just happens to be what they have. It's not totally who they are. It's just a small part of them. I mean, I know that's such a cliche thing to say, and everybody says it, but there must be some truth in that. And I think for you to be here in this group to ask us this question, just like Jen just said, I give you a whole lot of credit. And I tell newly diagnosed people that they're ironically diagnosed at a good time, because when Cherie and I were diagnosed, we didn't have the convenience of the internet or of groups or reaching out or any, great books to read on, we had snail mail, phone calls, and not much information. It's a great time to reach out and get the support you need. And it is a wonderful community. You just look left and right and everywhere else, and you'll find people that are ready to help you, honestly.
And Ray, I'd just like to mention too, on behalf of the Multiple Sclerosis Foundation, that family, friends, and loved ones are welcome to reach out to us as well. That we'll be happy to provide you with information that will let you learn more about MS. And we even have some booklets and brochures that are specifically geared towards care partners to help you understand what your loved one with MS is going through. We have a question, or it's really more of a comment, but I'd like to address it, from Michael on Facebook. He says, being disabled is something that I'm not adjusting to very well. My wife takes great care of me. I just feel like a burden to her, especially when we get together on holidays. I was diagnosed in April of 2020. What words of advice do you have for Michael on how to deal with those feelings?
Well, I'm glad you're here, Michael, and I'm glad that you're talking about this and that you're concerned about it. And because communication, as we've been saying all along, is so vital to living with this disease. It's not an easy one to get used to, and entering this disability community is not an easy thing to say. But realize that you are valued just the way that you are, no matter what that is, and that this community is here for you. I think that you should know that you're always enough exactly as you are, and you're doing the right thing by asking us these questions. You are enough. Believe me, you are. And I think that you should keep asking these questions until you realize that too. Maybe you do, maybe you don't. But being here with us and being part of this wonderful community that's being provided for us is the step in the right direction. Keep asking those questions, keep researching, keep talking to the people that you trust, keep looking at the organizations that are trustworthy to get more information. You'll find yourself believing in yourself more and more and more. It's a work in progress. But everyone sitting here right now, we're all works in progress, So I wish you so much luck. And I just hope that you keep reaching out to everyone here as you go along on your journey.
And one thing too, Michael, is that I've come to realize over the years that I'm not what I do, I'm who I am. And I know when at one point I lost my voice, I had done quite a bit of professional singing as well as being a church musician. And I'd had some surgery that had partially paralyzed a vocal cord, and I lost my voice. And that was who I identified as. I didn't identify as Cherie with all the other components. And eventually the voice came back with some therapy. But if you're feeling like you're a burden because you can't do, I invite you to get reacquainted with who you are rather than what you do that defines you.
I saw something recently that I thought was really interesting on the point of that B word, that there's a difference between a challenge and a burden, and that because of what you're going through, you may present a challenge to your partner, but that doesn't necessarily equate to being a burden. A burden is something unwanted, and if your partner didn't want you, they wouldn't be with you. So I think that's something for all of us to keep in mind. All right, and now we have a question or comment from David. David, go ahead and unmute yourself.
Hi, Casey.
Hi, David.
Hi, David.
Hey, Dan and Jen. My comment, I have a comment and for the panelists. I really enjoyed this show on MS and caregivers. I was diagnosed in 1997 at the age of 14. And so my caregivers were my parents, my mom, my dad, my sister and brother. And even to, I'm 38 years old now. And I'm so grateful and blessed that they've always been in my life. And just listening to this show tonight, Casey talked about not wanting to be a burden. And you all know that you all feel like you've been a burden, and you just have to trust the one Almighty that you will make it. And I just thank God that you had this show tonight, and I really learned a lot, and I'm grateful. Good job.
Thanks, you.
David.
Thanks,
Thank
David.
you, David.
No problem.
I wish you well on your continued journey. We're so happy to have you here, and bless you and your family for being so supportive and surrounding you with just what you need. That's sentiment coming from David is being echoed in the comments we see coming in. Ray says, "You're all inspiring. Thank you." And Alicia, who I'm assuming is the Alicia from Indiana that Ray talked about, said, "Thank you all so very much. You're the perfect group to hear from. You've given me hope for my future battling MS."
Yay.
Good.
So I'd also like to echo that sentiment. You have been the perfect group. What a wonderful conversation this has been. Thank you for being on our panel. And with that, we'll close out and say good night. Are there any final thoughts that you'd like to share?
No,
I just want to thank you for the opportunity of being part of this panel and for National Caregivers Month. I think it's an important one. I love everyone here. I've known them for a long time. And Casey, I've known you for a really long time. Thank you for this special opportunity.
thank you so much. We look
Thank
forward to your next one. That sounds very interesting.
Yeah.
Yeah, thanks for having us. This is good.
Thank you all for being here. Well, with that, I'll wish everyone a good night, and we hope we'll see you next week for the COVID-19 update.